Hi everyone, my name is HUONG and now I'm currently working at the National Cancer Institute and Hanoi Medical University in Vietnam. Today I would like to present our study on the delay in diagnosis and treatment of the breast cancer in Vietnam. My presentation including the following the past, I would like to introduce some information on the breast cancer in Vietnam and also the relationship between the delayed diagnosis and treatment and the outcome of the breast cancer care. And then I would like to present on the aim and methods, research of our study, result and the conclusion. Firstly, the non-communicable disease in Vietnam is the leading cause of death, and nearly 8 out of 10 people die from NCD, and it is estimated in the 2060 that Vietnam had more than 548,000 deaths caused by 77% of the non-communicable disease, and the daily due to the non-communicable disease accounts for 70% of the total burden of the disease, in which the most common non-communicable disease in Vietnam, including cardiovascular disease, cancer, COPD, and diabetes, where the cancer take 19% of the death of the non-communicable disease in Vietnam. Concerning to the cancer in Vietnam and reported from the Global Gun in 2020, and we can see in here that the number of new cases in Vietnam is 182,000 of the new case, and the number of deaths by the cancer is more than 122,000 people die from the cancer. In which you can see here the breast cancer is one of the 5 most common cancer in Vietnam for both sex and also for the woman. And the new of the breast cancer in Vietnam in 2020, it checked around 11.8% and 21,500 new case of breast cancer in Vietnam. And our study about the projection of 5 most common cancer in Vietnam in 2025. And in this picture, we can see here is the Ho Chi Minh and Hanoi city. That's the 2 biggest city in Vietnam. And we can see in here that the breast cancer is increasing in Hanoi and also in Ho Chi Minh city. In Vietnam, so we have the National Cancer Control Program, in which the breast cancer is one of the cancer that we are focused in the National Cancer Control Program. Even so, we don't. If also we have a National Cancer Control Program, but so we don't have a national screening program, and also the health insurance is not covered for the breast cancer screening and cervical cancer screening. When we starting the National Cancer Control Program in 2008, and our study investigated in the 5 oncology hospital in Vietnam to see that the early detection of breast cancer is around 50%. But in our study in 2020, we can see that after the awareness campaign and also the cancer screening program and breast cancer early detection is around 70%. And our hospital is a National Cancer Hospital, is the biggest oncology hospital in Vietnam, which in which we have 2,400 beds, and the breast cancer is also one of the 10 most common cancer coming to our hospital. And the most common age group of the breast cancer coming to our hospital during the 3 years is around 40 to 60 years old. and more than 70% of the breast cancer diagnosis at our hospital is as a stage 1 and a stage 2. And many study in at the international to show that is the delay of the cancer diagnosis and treatment and the outcome, like the low the efficacy of the treatment. Also, for the delay diagnosis and treatment is the financial burden of the cancer treatment, and also it affected by the higher mortality and the poor survival. And the delay time is the definition is the time interval between the symptom recognition to the diagnosis and initiated treatment equal to existing treatment. And we divide into the three levels. So no delay, that means the time interval is less than 3 months. The moderate delay with the time interval from the 3 to 8 months, and serious delay when the time interval is more than 9 months. And from our knowledge, there is no study in Vietnam to identify the delay of the breast cancer diagnosis and the treatment. And this is why our group to study on the Vietnam breast cancer study, in which one part, very important part, is we investigate the delays of breast cancer diagnosis and the treatment with the two aims of our study. And the first aim is to evaluate the extent of the delay from the first symptom recognition to the initiation of diagnosis and treatment. And the second aim of our study is to identify the reason and barriers related to the delay of the breast cancer. And the study population in our study, we recruit the patient as the age groups from 18 to 79 years old, and we recruit the breast cancer patient from the inpatient surgical units and chemotherapy in and outpatient. We also recruit the patient from the two hospitals in the north of Vietnam, such as the Vietnam National Cancer Hospital and Hanoi Oncology Hospital. And this patient we recruit is come to the hospital for diagnosis and treatment during the 2017 and 2018. And the instrument for our study is a self-reported from the breast cancer. And the definition of the delay time is the length of the time interval from the first sign noticeable breast cancer symptom to the diagnosis and initiation of the treatment, with the definition of the no delay is less than 3 months. And the reason and barrier in the delay, we investigate about the reason concerning to the financial barrier, physical barrier, psychological barrier, and the lack of properties and knowledge of the patient. And we recruit the 462 breast cancer patients involved in our study. And the age of the diagnosis of our participant is more than 31% of the breast cancer patient less than 45 years, and 37.9% of the breast cancer patient in the age group from 45 to 54 years, and most of the breast cancer patient is have a marriage status with 84%, and 44.2% of our patient with the education as a middle school, and 22.9% of the breast cancer patient have a level in education is at the high school. And we also investigate the travel time to the healthcare setting, and we can see that nearly 30% of the breast cancer women have the time the traveling time to the healthcare setting is less than 30 minutes, and 27.3% of our breast cancer participation we have the traveling time to the healthcare setting is more than 1 hour or more than 60 minutes. And in our study, and we have 3.7% of the breast cancer patient have breast cancer first degree, and 70.5% of the participants have the family history as the cancer first degree, and the average annual per capita income by million Vietnamese dong is around 22.7 million. And we also investigated the symptom diagnosis, modality, and delay diagnosis treatment. And the result of our study shows that 96.3% of the patient have the first noted symptom is the lumps or smudge, and the second common is pain or tenderness. It's around 31.7%, and we have around 24% of the breast cancer patient has the first noted symptom is the strain side of the breast, and the sample and 54% of the patient have only one symptom, nausea, while 31.6% of the patient have the two symptom, nausea, and the circumstance of our breast cancer patient detection, most of them is around 93.4%. The circumstance of the breast cancer detection is the cell notice symptom or the lump, while only 1.1% of the breast cancer detection by the mammographic screening. That is maybe because in our countries, because of the lacking of the resource, and the cancer screening mostly by the clinical examination, ultrasound, and if the patient have the symptom of the breast cancer, they have further to go for the mammographic screening, and the visit 73.5% of our breast cancer visits the doctor right after the first noted problem is the breast. We also have the 26.4% of the patient say don't visit the doctor right after the first noted problem with the breast cancer. And the barrier and the reason for the delay in seeking medical care we investigate by the reason, by the financial and physical barrier, psychological barrier, like a property knowledge, and for the concerning to the financial and physical barrier, we can see that 51.6% of the breast cancer patient they need the time away from family and work, and they answer that they are too busy to come for the seeking medical care, while the 50.6% of the breast cancer they have the reason for delays the seeking medical care is they worry about the cost too expensive that they cannot cover. And 13.9% of the breast cancer patient they say that because the hospital is too far away, so that by distance or the lacking of the transportation, so that they delay in the seeking medical care. And concerning to the psychological barrier, the result of study to show that the 10.7% of our breast cancer they thought of the herbal or as an alternative medicine treatment, even because in Vietnam we also have some the herbal also live. So that's many cancer patients. They believe that is the herbal or the leaves can cure for the cancer, and also they are very afraid of to getting the cancer, and that is why this is one reason that they delay in seeking medical care. And 74% of the breast cancer, the reason, the barrier for the delay in seeking medical care is a confidential concern. And 6.6% of breast cancer, they fear of the doctor and they fear of the hospital. And that is why they don't want to seek the medical care right after they have suffered the signature of the disease. And also the 1.8% of the breast cancer women, they fear of the losing the job. And that is why they delay in the seeking medical care. And also in our study to show that the 34.4% of the women of the breast cancer, they unconcerned about the symptom, and that is why they delay for the seeking medical care. And this reason, and that's maybe in the future we must to do more the campaign and more the health education for the population concerning to the breast cancer. The results from our study to show that in our study, the 51.5% of the breast cancer, they don't have no delay in the seeking medical care. But we still, the results still show that 31% of the breast cancer has a moderate delay, and also the 70.5% has a serious delay in diagnosis and treatment. Is a must. This results must to show the the need to advocate for this is a concern, and to education or to do for the breast cancer in Vietnam. And this is a table to show you about the actual odds ratio for the delay diagnosis and treatment by barrier for delay in seeking medical care. And in this table, we can see that financial and the physical barrier of the at the moderate delay is the higher and have a significant compared to the patient. They don't have the financial and physical barrier, and the same reason in the psychological barrier between the breast cancer woman with they have a psychological barrier compared to the no psychological barrier at the moderate the delay. And also the lack of property knowledge, so we can see in here that is the higher of the breast cancer woman with the lack of property knowledge is the more delay significantly than the woman with the the equipped the knowledge on the breast cancer. But we don't see the different significant with the group of no delay and serious delay. We also do the hazard ratio for the delay in diagnosis and treatment by barrier for the delay in seeking medical care in stratified analysis. And this table, we use the multivariate logistic regression modern access for the age at diagnosis, education level, average annual per capita income, resident number of symptoms, and except for the corresponding variable used for stratification. And in this table, so we can see that there is a significance between the age group of the breast cancer by the lack of the property knowledge, and especially for the breast cancer with the older than the 45 years old. And the study of, and in our study, and we can see that the length of the delay diagnosis and seeking the diagnosis and treatment of the breast cancer woman in Vietnam with the time interval is the shorter than some of the other low income country, but the higher in the but the longer than the many the high income country. And our study to show that the diagnosis and treatment delay exists among the female breast cancer patient in Vietnam, and the patient who has the financial and physical barrier, psychological barrier, or lack of property knowledge were more likely to experience delay in diagnosis and treatment. And that is the needed to develop a property public health policy to address this concern. And we also need some more deeply research to quantify the access barrier and qualify deficiency in breast cancer care in Vietnam. And this is our very briefly the result of the study. And thank you for your attention.